One other thing I wanted to talk about today was healthcare options during retirement. A lot of you may be approaching retirement or maybe considering retirement around this time of year, and you're kind of confused about what options you might have. First and foremost, if you have coverage that's available to you on your job that's portable, meaning once you separate employment that you can now take that health insurance coverage with you, I'd highly recommend that you look into what the expenses are around that and whether or not you can indeed take that coverage with you, because that may be one of your best options out there, because it may be the most comprehensive in nature, meaning it gives you not only health insurance but maybe some dental benefits as well as vision benefits, which are typically not covered in traditional Medicare or Medicare Advantage plans, which we'll discuss in a second. Now, part of retirement, or part of one of your retirement benefits that is afforded to all Americans once you turn age 65, or maybe at an earlier age if you have some strenuous health issues, is Medicare. And for Medicare, you're available for 3 months prior and 3 months after your 65th birthday. So that will be an opportunity where you can just apply to get your red, white, and blue card from the federal government for your Medicare benefits. And that often gives you Part A, and if you elect to do so, Part B of Medicare, which comes at a cost, or you have to pay a premium in order to get Part B of Medicare. But Medicare is typically divided up into 4 different parts, which we'll discuss. Part A is your hospital benefit, Part B being your medical benefits. And then you have Part C. Part C is what you call a Medicare Advantage plan, or an MAPD plan. These plans typically give you your hospital, your medical benefits, as well as your prescription drug benefits, all within one plan, and it comes at a 0 or maybe a very low premium on a monthly basis. Now, here's some pitfalls of these particular plans. I actually happen to be in the business and sold these plans for a number of years prior to going more into the planning aspect of things. But with these plans, they're typically regional type of plans. So if you're a person that plans on traveling a lot during your retirement years, then an MAPD or Medicare Advantage plan may not be the plan for you, because it's only going to be specific to your state or the region that you live in within your particular state. And oftentimes these plans typically change very rapidly, meaning it'll go from an HMO plan to a PPO plan, and then now you're having to change your plan every year or so. These Medicare Advantage plans also come with what's called copays, meaning every time you go to see a doctor or a specialist, you have a respective copay associated with that. Now, on the other side, if you're somebody that knows you're going to travel extensively and you want to have coverage throughout the country, or maybe even sometimes abroad, then you may want to purchase what's called a Medicare supplement plan, or a MedSup, or a Medigap plan. These plans are typically very comprehensive in terms of the type of coverage that they have available for you, even covering blood transfusions. However, unlike the Medicare Advantage plan, a MedSup plan, you have to purchase a separate Part D plan, which the D in Medicare language stands for prescription drugs. So you have to have a prescription drug plan that you purchase that will then allow you to purchase your prescriptions on a monthly basis. And a little note about your prescription drug coverage: you need to have prescription drug coverage in retirement if you have certain prescriptions that you take on a monthly basis. Otherwise, you will be assessed a penalty or a late enrollment penalty in prescription drug coverage, and that penalty kind of is changed on an annual basis and assessed based on how many months you've gone without having the required coverage necessary. Now, if you have any further questions, or you'd like to have a more in-depth conversation surrounding your healthcare options in retirement, I know this was very brief,